Now we'll discuss about a plethysmography. So, photoplethysmography (PPG). It is a simple optical technique used to detect the volumetric changes in blood in peripheral circulation. So, the main principle of photoplethysmography is it uses a low intensity infrared light. So, when light travels through the biological tissues, it is absorbed by the bones, skin pigments, and both venous and arterial blood. So, the voltage signal from PPG is proportional to the quantity of blood flowing through the blood vessels. And the PPG signal has several components including volumetric changes in arterial blood which is associated with the cardiac activity. The blood flow variations mostly occur in the arteries but not in veins. PPG waveform. So the blood flow changes as the waveform with the help of bar or a graph. So waveform has an alternating current component and direct current component, and the DC component arises from the optical signals reflected or transmitted by the tissues, and the DC component shows the minor changes with the respiration. The main uses of photoplethysmography is clinical psychological monitoring, blood oxygen saturation, blood pressure, cardiac output, heart rate, respiration, vascular assessment, arterial diseases, venous assessment, arterial compliance and aging. Next is the wearable device. So using this technology, wearable pulse rate monitors have been developed. So here it uses the green lighting emitting diodes, and photodetectors help in a reliable monitoring of pulse rate. So these intensity changes are the tissues and provide vital cardiovascular information such as the pulse rate. So here you can see the diagram IR LED, and we have placing the finger, and photodetector is used to detect the signals and heartbeat interval. So we will get the pulse waveform. Next is the body plethysmography. It is a simple painless test, takes lung volume measurements. That is, the lung volume is the amount of air you inhale and exhale. So here the body plethysmography is one method used to diagnose and manage respiratory all your testing options with your doctor. Why is the body plethysmography used? So it is more accurate method. Sometimes the only way to take certain lung volume measurements, this technique is used. And there are many kinds of lung volume measurements which are measured using tests such as spirometry. So how is this method is performed is in hospital pulmonary function lab. So lung volume measurements takes a little as 3 minutes, but the entire procedure will take about 20 to 30 minutes. Body plethysmography generally involves the some of the steps, that is, you will loosen tight or restrictive clothing. You will sit or stand inside a clear or airtight chamber, so that about 45 minutes to the temperature in the booth. You can see in the diagram. We will inhale and exhale through the mouthpiece against a closed shutter device of particular volume. So a chest volume will expand and increase the pressure in the box as you breathe against the shutter. Pulmonary function technologist has specialized training and education to perform these pulmonary function tests. Risks and potential complications. So here it is a safe procedure without serious risks and complications. So the people with the following conditions may not tolerate body plethysmography is claustrophobia, mental confusion, any condition requiring continuous oxygen therapy that cannot be stopped to take the test. Next is the blood gas analyzer. So a blood gas test measures the amount of oxygen and carbon dioxide in the blood. So test is commonly known as blood gas analyzer test. So as blood passes through your lungs, the oxygen flows into the blood while carbon dioxide flows out of the blood into the lungs. So imbalances in oxygen, carbon dioxide and pH values of your blood can indicate the presence of certain medical conditions like conditions. So these may include kidney failure, heart failure, uncontrolled diabetics, hemorrhage, chemical poisoning, drugs, overdoses and shock. So why is the blood gas test is done? So it is precise measurement of oxygen and carbon dioxide levels in your body, and this test is most commonly used in hospitals setting to determine the management of acutely ill patients. And a doctor may order a blood gas test if you are showing symptoms of an oxygen, carbon dioxide or pH imbalance. So main symptoms is shortness of breath, difficulty in breathing, confusion, nausea. So this blood gas analysis consists of 3 electrodes, pH, PCO2 and PCO2 at 37 degrees Celsius. So the arterial PCO2 and POO2 can be approximated using the heated skin surface. Hemoglobin oxygen saturation, that is SO2 percentage, is also directly measured by multivalent blood oximeters. So this figure shows the 3 electrodes pulse oximeter probe. So it is an acid based compensation diagram. So first three function: blood gas analyzer, a combined PO2 PCO2 transglutinase electrode in use on a child. So and pulse oximeter probe on the finger. So this is the diagram of blood gas analyzer. Thank you.